Hello everyone, how are you today? Welcome to my channel. This is Dr. Education and I am Dr. Paramjeet. Those who don't know me, I am a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru Nagar, Ghaziabad, Delhi NCR, and this is my channel. In this channel, I give you simplified medical explanations about the most common healthcare topic. So this information which I give you is not my opinion, not the opinion of a single doctor. It is an internationally accepted information directly deduced from the International US Medical Library. So you can trust this information. There are already a lot of videos present on my channel. You can go browse for your concerned health topic and know about them in simple language, which your doctor does not tell you. So today's topic is diet in hypothyroidism. Hypothyroid and hyperthyroid, diet in thyroid problems overall. So guys, we have already made a couple of videos about hypothyroidism and hyperthyroidism in English and Hindi. We've explained the importance of iodine in diet in the last couple of videos. If you haven't watched them, then check them out and don't forget to hit the subscribe button.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, we have already talked that hypothyroidism is basically caused by many things, including autoimmune destruction of thyroid gland, infections, inflammations because of surgery, radiations because of drugs, pregnancy, etc., and even because of iodine deficiency, which is in itself rare. So all these things which cause hypothyroidism, obviously, just by taking or avoiding some fruits, you cannot nullify these factors. So if any of these things are causing hypothyroidism in your case, that particular thing needs to be tackled first. Now let's talk about the whole fuss. What to eat, what to avoid in hypothyroid, hyperthyroid, euthyroid. Now let's first understand. Euthyroid is a situation where you might have a predisposition to have hypothyroid, but your TSH, T3, T4 levels are normal. So your euthyroid, your hormone levels are normal. So in this situation, when you are euthyroid, what you need to eat? Obviously, you need to have an iodine adequate diet. You need to have iodine in proper amounts. Then we had seen in the last video, then apart from iodine, which is the main substrate for thyroid hormone production, you need selenium, you need zinc, you need iron. So you need to have selenium rich, iron rich, zinc rich, and vitamin A is also needed. Vitamin A rich foods. You need to include antioxidants in your diet like beta carotenes, omega 3 fatty acids. So all these things should be more in your diet if you are just euthyroid and you have a predisposition for hypothyroidism and you want to avoid hypothyroidism. Then if you are just euthyroid, predisposition to hypothyroid, what you should avoid? Literally, actually nothing. You can eat everything. The only thing which you need to avoid in high quantities are soy proteins and aspartame, sugar free gold aspartame, that you need to avoid. And the second thing which you need to avoid, if you have celiac disease, then you need to avoid gluten or else no. What about hypothyroid? In hypothyroid situations, obviously you need to take iodine rich foods. Now, what are these foods? Iodine is mostly adequate and very high in seafoods. It's more in sea vegetables like kelp, then berries, all the cranberries and strawberries and blueberries, and then in milk and milk products, in cheese, in yogurt, in all the milk products which you can get, then potato, navy beans, and even common salt. Iodized salt is most important, which itself can actually satisfy iodine needs if you take it in a proper amount. So you take all these things in your diet If you are hypothyroid, it will just help. Don't think that it will stop your medications. No, it won't. Second thing which you need to take is selenium rich foods. What are selenium rich foods? Selenium is mostly found in mushrooms, garlic, onion, eggs, then wheat germ, then sunflower seed, sesame seed, brazil nuts, chicken meat. So selenium is more in these things. Iron is more in meat, in fish liver, then in eggs, in tofu, then in peas, pulses, nuts, and seeds, dry fruits, and then whole grains. So iron is present in all these things. Then what you need to take more is antioxidants. And antioxidants are so adequately vastly present in all fruits, including citrus fruits, all the berries, cranberries, raspberries, strawberries, all the fruits are studded with antioxidants. And kidney beans are very high in antioxidants, and your green tea has antioxidants. So you should take all these things. You can take all these things as antioxidant rich foods. Then if you are hypothyroid, obviously your energy levels are low, so you should take low calorie food, and you should take salt. The most important thing, salt, because salt has iodine. Then what should you avoid if you have hypothyroidism? What you should avoid is, you should avoid excessive salt, because in hypothyroidism you already have everything slowed down. So if you have excess salt in your body, it will have more volume in the blood, and the tendency of swelling in your body will become more. So that's why you should avoid excessive. Adequate salt is fine, but excessive salt is to be avoided. Then goitrogenic foods, like we already discussed, like cabbage and cauliflower, radish, and all the cassava and brassica and cruciferous vegetables need to be cooked first before eating, or and you should avoid eating them raw. That's very important. And then red meat, all the mutton and pork, you need to avoid them if you are hypothyroid, because you won't be able to actually metabolize so much strong meats very much easily. So all these things are about the dietary advice of hypothyroid patients. Then coming on to hyperthyroid, if you are having hyperthyroid situation, then you need to obviously eat more of the thyroid suppressive foods, like these goitrogenic foods in the raw form, including raw broccoli, cabbage, and cauliflower, radish, all these cruciferous vegetables. Eat them raw and suppress your thyroid levels. They help. They won't be just the sole factor to do the purpose, but they will help. Second, because you are hyperthyroid, your activity, your internal metabolism is so fast, you need to burn more calorie, you need more foods. That's why you need to take high calorie and high nutritious food. Then if you are hyperthyroid, obviously you need to avoid something, especially iodine. Already your thyroid gland is making a lot of thyroxine. You should avoid taking iodine rich foods, which we already discussed. You should avoid eating low calorie foods like salads and vegetables. So you should eat high calorie foods like red meats and liver fish, non-vegetarian foods. So you should eat high calorie foods, milk and milk products, etc. So guys, this is all which I can tell you about diet in thyroid diseases, and how you can actually avoid thyroid problems is by a regular good healthy diet. And because healthy diet with a good amount of antioxidants and good amount of iron, zinc, selenium, and iodine will help your thyroid gland function normally and avoid autoimmune diseases, infections, inflammations, and it will lead to less chances for you to develop the disease in the future. Especially if you are pregnant and you require more iodine in your diet, discuss this factor with your doctor. If you're showing signs of hypothyroidism or predisposition to hypothyroidism, then do follow the diet which I have advised. Don't eat raw vegetables which are goitrogenic. Cook them. After cooking you can eat them, there is no problem with that. Don't stop eating gluten products because of the ads and other things. There are so many bullshit videos. There are so many nonsense diet given about thyroid all around YouTube. Don't believe in them. This is the latest. This is the authentic, verified information directly from the US International Medical Library, so you can trust this information. So I hope you have learned something from this information, and don't forget to check out the other videos about thyroid problems in my channel. And if you like them, don't forget to subscribe and hit the bell icon and share these videos to all those people who have thyroid problems. So till next time, take care of yourself, be connected, be healthy.